Headed to the KUA to the Zoom room. We sitting by from the Guam National Guard. Mark Scott. Good morning, Mark.
Morning, Chris. Hi, Bree. Hi, Jason. Hi, Joe, sir. Good morning, Guam. Half a day.
There you go. 9:31. We'll just start, I guess, with COVID talk. What are you guys involved in as far as the COVID and vaccination? Not just for today, but for the coming week.
Yeah, you said it, Chris. That's our main effort right now. Is the COVID-19 vaccination clinic at the UOG Fieldhouse in support of public health. You might have heard it before, but we're accepting appointments to be booked online at Eventbrite. And we encourage folks to go ahead and book your appointment if you're eligible. And dose 2 is the priority. So we've been doing this for almost a month now, and we're going to continue to do it as long as we need to so we can help liberate Guam.
I know that initially there was a little bit of rough spot there when you stood it up over at UOG, but since then you've kind of ironed everything out, Mark. And if you could just describe the process for the people who are going.
Yeah, we had some growing pains in the beginning, as expected, right? But we've worked with our partners to help smooth things out, and there's some time that it takes for the messaging to kind of mature and get out there, right? So the messaging that we like to tell people is, of course, you can walk in if you don't make an appointment. If you're due for your dose 2 or you're eligible, make sure you're eligible, and then you can come walk in. The message that we're trying to really make clear is that it doesn't really do much good to come and line up at 8 in the morning, 9 in the morning, and really crowd our opening gate, which is at 1 p.m. It just leads to longer waiting times. So if you're not able to book your appointment online and you want to walk in, we encourage folks to do so at some point in the afternoon, go around Manilao, see the sights, and come visit us later in the day. As we see later afternoon, early evening, there's no line, and people just come right through without waiting at all. So that's our encouragement to our walk-ins. Another thing, Chris, that helped us get a little bit more efficient, of course, is our partners. We couldn't do it without them. Public health is there. DPW is even there for accessibility. University of Guam has helped us in so many ways. It wouldn't be possible without them. The Global Learning and Engagement Office. We have AmeriCorps volunteers there. Chris, we even have off-duty nurses coming from the hospitals, both GMH and GRMC, to just come shoot on their time off or their days off. So we have to thank our partners as well for all the help in doing this.
What about quarantine?
Yeah, we're still there too. The quarantine facility is still operating, again, in support of public health down at the Dusit Beach Resort and the Dusit Tani.
Is the PCOR 3 declaration affecting the Guard's operations, not necessarily in terms of COVID response, but in terms of what you have and haven't been able to do because of the various protocols and EOs that have come out?
Well, I'll tell you one thing, that this PCOR 3, I heard the governor is looking at changing it. One thing that it's having us do is reassessing where our forces are put and how we're using our forces. So you might know that the Guard is there in case we're needed for emergency, which is pretty much what defined the whole past year for us. We're intended to kind of hold things down until the civil authorities who we support can kind of get it back on their own. Now that we're looking at PCOR 3, now that there's a lot more vaccines going in arms, General Aggie is taking a look at, hey, do we need everyone to be on? Are we being good stewards of federal funds? Do these employees at the hotels need their jobs back? Can we start, kind of withdrawing safely in coordination with our partners the right way to draw down and get back to our readiness? Prioritize this vaccine clinic, which is our main effort, and make those kinds of changes. So yes, that is what we're looking at right now.
That was interesting what you said about hotel workers returning to the job. How is that just something that was kind of mentioned, or is that an active conversation?
That's something that we've been aware of since day one. So going back to the Guard being a support role temporarily in case of an emergency, we never want to replace all the people who are supposed to be doing what they're doing. We want to be able to come in and help as long as it's needed and then get back out, because we do have some other stuff to do, right? We're not in the business of employing people. We don't want to replace anyone's job. We just want to stay as long as we're needed. And then if it's not critical or essential anymore, we want to get out. So when we talk about the folks, say down in the hotel industry, who could be bringing food or who could be helping, say, move luggage and things like that, if it's not considered critical for us to be there, That's what we're evaluating right now.
I had to ask you here about I mean, we talked about it the other day with those letters that were coming out. I'm sure you're familiar with these a lot of these anonymous letters that had come out, and then there was letters that were clapping back at the anonymous letters. And anyway, so I had got a tip, Mark, that there were some high level changes in personnel because of an investigation. Are you able to confirm or give us any info at all about? I'm trying to find that now. About, and I know there's probably some personnel issues at stake here, but I just want, oh yeah. So anyway, there was a tip that we had got. So the Guard is going through some long-awaited changes. Diaz, Gacono, and Pantone have been fired as a result of the big investigation into actions over the past 2 years. I guess if you want to just unpack that in any way that you can, or you're able to.
I can, Chris. Yeah, thanks. It's a little unfortunate, that we would have to stop and talk about this because there's so much work to be done. No one got fired. I'll say that up front. Nobody got fired. And I'll tell you what's unfortunate about it is some of these folks are going through some personal things, right? State Sergeant Major Diaz is suffering and grieving the loss of her mother. And as the sole caretaker, she has some things that she needs to do. We have an acting State Sergeant Major right now, who is Sergeant Major Celso Leone, who's doing a bang-up job. But it's unfortunate that we'd have to drag these people's personal affairs out like this and say that they got fired when that's not the case. The same with Colonel Giacono. His father-in-law sustained some falls and he had to go be there for his family. So yes, there are changes in leadership that we're seeing, but to say that they were fired is a little bit bad taste, and it's unfortunate that we'd have to address these things. These people's personal issues. Colonel Panton is going through a normal PCS, permanent change of station. She did her tour here, and in a few more months, she'll finish her tour and go back to the National Guard Bureau where she came from. There's no firings and stuff like that. We just prefer to focus on the task at hand, which is liberating Guam, helping get the vaccines and arms and doing our job, really. Rumors are rumors, I got it, but the Game of Thrones has nothing to do with our job. So we're going to focus on what we have to do.
Thank you, Mark. And I'm sure you understand that I'm in a position where we get a tip, we got to ask about it. So,
no, I got it, Chris. Yeah. Like I'll tell you every time too. Transparency is transparency.
Right on.
There's nothing to hide from. Just tell them the truth. The story tells itself, and it's fine, Chris. We're always here to answer your questions and be transparent.
Let me just ask you this, though, because I know that we had seen a letter from the Guard Bureau, and I can't recall if it was regarding any type of investigation, but I know there were certain things that were being looked into. Have those been resolved, or is that still ongoing?
With regard to which one, Chris? Sorry.
I believe there was something about the state promotion, and there was a letter from General Lengyel sent to the local guard.
I'm not tracking that one, Chris. Okay. I can ask around, but I'm not hearing anything about. So Lengyel is no longer the National Guard Bureau. He's been replaced already. So that might be some old news, but
so you can just say unequivocally that there currently is no investigation by the National Guard Bureau into the local guard units or its leadership.
I can't say that. No. So I'll tell you, Chris. If I was to go find some investigating officer, I can't hair in my mask. If I was to go find some inspector general and ask them what's the details of all our investigations, Chris, they tell me to go kick rocks too, because I don't have a need to know or interfere with their ongoing stuff. I don't have access to those things like most of the rest of us do.
Thanks, Mark. Lee? Oh.
How's the vaccination clinics going?
Yeah, we touched on it a little. It's so far so good. Really, Bria, it boils down to thanking the community for coming out and their support and their patience. Thanks to people like you for helping us get out the good word, and thanks to our partners down there at UOG. So helpful, Public Health, UOG, AmeriCorps, Serve Guam. It's going smooth. Aside from, I'm going to take the opportunity to say it again. Aside from the longest lines of the day, which are at our 1 o'clock opening. If folks want to avoid those long lines, please come later in the day, afternoon, or we're open till 7 p.m. So that'll help you avoid some of the longer lines of the day. And other than that, Bree, it's a continue mission, carry on, drive on.
What about vaccinations of the Guards members?
What about them?
Do you have any numbers? Like how many have been vaccinated fully so far?
Yeah. Oh boy, I had that from drill, and I'm gonna have to go scroll back. You know, I get a million chats a day. Bree.
Okay.
Would you mind if I message that
Sure,
to you
no-
after
no
this?
problem,
'Cause
no
I did get
problem.
that. Yeah. But we have, it's the same as before, Bree. We have our supply come through independently from the allocation for the people. We have our supply come through the DoD side.
Yeah.
That's intended for military folks only. So even though I wasn't able to provide you a number right now, I think it's important to say that, yes, we do have our allotment, and it doesn't come from the people's batch.
Okay.
All right. Thanks, Mark.
Thank you, Mark.
Thank you guys too. And I say, Joe, sir, I saw you there at the clinic yesterday. Feel free to give us a plug, and I hope to hear from your experience and learn how we can do things better.
He's giving a thumbs up right now. Right on. Okay.
He was
My
in
man.
here doing his
man.
exercises. He's good.
Yeah, he's fine. If he's doing his morning squats, so
Yeah. Him and Jason do their daily morning squats on the side, which nobody gets to see. We
yeah.
should shoot video.
We
of
need to
that.
do a squat cam.
I think you should lead with that segment tomorrow morning.
They make it look easy. All right. Hey, Mark, thank you, man. Appreciate it.
Thank you guys
Okay,
too. Take care.
stay
Stay
safe.
safe.
Okay, right on.